Welcome, and thank you for joining me for my presentation on the Personality Assessment Inventory. This assessment tool was created by Dr. Leslie Morey in 1991 and published by the Psychological Assessment Resources. Dr. Morey designed this assessment tool as a multidimensional alternative to the Minnesota Multiphasic Personality Inventory for use in assessing abnormal personality traits. The Personality Assessment Inventory is usable for individuals 18 years of age and older. This assessment inventory is designed as a self-report measure used to assess common forms of psychopathologies, interpersonal style, and factors which impact treatment. It also provides assistance in making a clinical diagnosis as well as screening for psychopathologies and planning treatment. The Personality Assessment Inventory endured a sophisticated multi-stage development process and stressed rational test construction practices. This tool began with over 2,000 items, which were reduced to 1,086 through an editorial review by the development team to remove offensive or biased content, to eliminate double negatives and single negatives, as well as colloquialisms, and to ensure that the content was specific to the syndromes in question. Following this initial review and assessment, the assessment was reviewed by two panels of judges. The first panel was composed of 15 Black, Hispanic, and whites, both professionals and those in lay capacity, and they sought to minimize the possibility of racial bias or offensive or confusing content. The second panel was a panel of 8 experts in psychopathology who assessed content about the constructs of interest. This process brought the number of items down to 776, which were then subjected to empirical analysis. Items were evaluated using a group of 306 students for item-to-scale correlations, the role of stylistic factors, item discrimination regarding other scales, and susceptibility to deliberate manipulation. At this stage, items were again evaluated for possible gender bias. Upon completion of this empirical review, the items were reduced to 597, which were then further evaluated empirically. In this final last stage, it included 229 normal individuals, 96 psychiatric patients, and 89 students who were given different instruction sets. Again, items were eliminated if they were sensitive to a particular response style or if they were sensitive to gender, race, and age bias, or if they failed to discriminate normal from the clinical group, bringing the total number of items on the Personality Assessment Inventory to 344, which are scored on 22 scales and contain 10 of the items containing subscales. The assessment takes about 50 to 60 minutes to complete. It requires the respondent to use a 4-point ordinal scale in which their choices are false, which is defined as not true in any way, to slightly true, mainly true, or very true. This assessment tool can be done with a paper and pencil test or assessment and then interpreted manually by the clinician, or it can be done using a software program that's provided by the PAI with a clinical report that can be generated, which includes both full-scale and subscale profiles, or it can be done as a paper and pencil assessment, and then the information can be inputted into the computer program to generate a report. Regarding the validity and reliability, the PAI was normed using 3 sample groups. The first group included 1,000 adults from the community. The second norming group included 1,296 patients from 69 various clinical locations, and the final group was 1,051 college students. The coefficient alphas for the median of the 22 scales were 0.81 for the 1,000 community adults and 0.86 for the clinical patients, and then a 0.83 for the college students, all well above the 0.70 cutoff for assessment validity. The test result reliability ranged from between 0.68 and 0.85, with the inconsistencies and infrequencies validity scores bringing these numbers down due to there being 0.31 and 0.48 respectively. According to Mori, the reliability study shows that the personality assessment inventory has a high degree of internal consistency. With the assessment, there are 4 validity scales built in, and it underwent 1,000 computer-generated random response protocols. It also successfully underwent fake good and fake bad studies. The scales of the personality assessment inventory include a validity scale, which includes inconsistency, infrequency, negative impressions, and positive impressions. It also includes a clinical scale, and in the clinical scale, it is seeking out diagnosis, which include somatic complaints, and the subscales are conversion, somatization, and health concerns. Then there's anxiety, which has subscales of cognitive, affective, and physiological. Third is anxiety-related disorders, including obsessive compulsive, phobias, and traumatic stress. Depression with subscales of cognitive, affective, and physiological. Mania with subscales of activity level, grandiosity, and irritability. Then we have schizophrenia, including psychotic experiences, social detachment, and thought disorder. Borderline features, including affective instability, identity problems, and negative relationships, as well as self-harm. 9 is antisocial features, including antisocial behaviors, egocentricity, and stimulus seeking. And then we have alcohol problems and drug problems. Under the treatment scale, we have aggressions with subscales of attitude, verbal aggression, and physical aggression. We have suicidal ideations, we have stress, non-support, and treatment rejection. And the fourth scale is the interpersonal scales of dominance and warmth. As stated previously, the assessment indicates high levels of test-retest reliability with a range of 0.68 to 0.85. However, the inconsistencies and the infrequencies validity scores were much lower, with scores of 0.31 and 0.48 respectively. Other assessments of this tool include a study in which the PAI correctly diagnosed individuals as either having or not having bipolar disorder, and this assessment had a 73% success rate. Also, according to Boone, the PAI full scale and the constructs they represent can be interpreted with some assurance. And in his paper, which he stated in his paper, Internal Consistencies, Reliability of the Personality Assessment Inventory with Psychiatric Inpatients. Also, according to Carlin, Creech, Grimes, Clark, Mager, and Morey, this study examined the utility and psychometric properties of the PAI with chronic pain patients and critical normative data to assist clinicians and researchers in assessment and treatment planning with this unique population. The results of the full-scale and subscale reliability analysis and factor analytic procedures provides significant support for the application of the PAI in chronic pain cases. Strength of this assessment tool include the relatively short amount of time that it takes to perform the assessment, as well as the option of having a short form for those who have attention deficit possibly, or who have time constraints. Also, it has been created at a 4th grade reading level, which enables a wide array of adults to use this assessment tool. It can be given on a computer system, or it can be given with the paper and pencil option. The assessment is normed for sex, age, and race. It demonstrates a good ability to accurately discriminate both faking good and faking bad, and the relationship between the construct implied by the scale is directly related to the actual scale content. Weaknesses include the fact that there are no multi-method, multi-trait analysis reported. Also, there is much debate around whether there are actually 4-dimensional structures, as in 21 exploratory factor analytic investigations, it was revealed that there are anywhere from 2 to 5 dimensions, and Holzella-Meyer determined that 3 dimensions were well supported, but that 4 were not. The personality assessment inventory aligns with Carl Jung and his theory of analytic psychology. It is tied with an individual perception of the world and the judgments they make about the world. Challenging aspects that I found on this project included my limited understanding of validity and reliability and comprehending the process of determining these scales. I also found it difficult to ascertain what theory of personality it aligned with, as it was never mentioned in any of the research articles or presentations I was able to obtain. My valuable takeaways include the importance of understanding who the assessment was normed on, what it was designed to measure, as well as the assessment's validity and reliability. And finally, the importance of acquiring the appropriate training prior to using assessment tools with a client. And the following are my references, and thank you for allowing me to share this presentation with you.